Sinuses are moist air-filled spaces within the bones of the face and around the nose. And if the lining becomes inflamed or it becomes infected, it's called sinusitis, also known as a sinus infection. Sinus infections are usually secondary infections, meaning that they follow a cold or another type of respiratory infection. So you mentioned that you've had a cold, and it's normal for that to persist for 7 to 10 days. Your body will usually take care of it. Most colds are due to viruses. But if it moves into your sinuses, then it can cause a sinus infection. The source can also be bacterial. So if it's a viral infection, then your body will just have to take care of it, and it might just need time. But if it's a bacterial infection, then your doctor can treat you using oral antibiotics, and it will help you feel better. Symptoms of a sinus infection usually include soreness around your face. Some people think that they have a toothache, or it's just really sensitive right here. And if you've noticed any of that pressure or pain, talk with your doctor, and after asking you more specific questions and performing an exam, they'll decide if treatment is warranted in your situation. Now, you mentioned that your 1-year-old has a runny nose, and that leaves you wondering if your child is getting sick as well. If all you ever see is a runny nose, then that's okay. You can just keep watching it. But if it's associated with other symptoms like a headache, difficulty breathing, like a barky, wheezy cough, or if he or she stops eating well, drinking well, those are all reasons to call a pediatrician. And again, same thing with you. They'll ask you more questions about your observations and decide if treatment or medical intervention is necessary. I hope that you start feeling better soon and that your little one stays healthy and well. And if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.